Assalamualaikum to you, Doctor. My name is Siti Zaharatul Laili binti Zulkifli, metric number 252873. So, in this video, I would like to present my group project titled Dental Care at Taiping. So, first of all, is location analysis. For the pros, a suitable place in the city centre, the location of clinic in this area can make it easy for people to use its service due to strategic position at areas that are developing and growing rapidly. In addition, electricity and water supply are available in this area. This will make it clinic to operate properly. Second is easy accessible area with high level of human traffic. The clinic have a right location to potentially customer will pass. The location of clinic in the middle of other shop will make it customer aware of its existence. And the last is easy to get public transport due to the location of the clinic in the open area. This will make easy for customer to get the public transport. And for the cons, first is lack of parking. This area provide ample parking space, but due to many shops close to the clinic and its surrounding, it will cause a lack of parking in the area. Customer have to wait or grab parking with other customer to park vehicle in this area. And second, there will be traffic jam at the peak hour. Because the clinic is located in a city area where there are many shops and buildings, so it will cause a traffic jam, especially at peak hour, and indirectly will restrict the movement of customer to move. And the last is compete with other passengers, especially in an emergency or urgent situation. That's all for me. My group member will continue the video presentation. Thank you.
Okay, Assalamualaikum to Dr. Fazila. My name is Nur Izzati binti Fazali. The metric number is 2530 and 23. I'd like to present about the layout planning. The layout planning for this Taiping dental care clinics. The arrangement of equipment, staff, workstation and department in these clinics, we explained just now. Basically in this clinic they have a 4 partition, which is the waiting area, the toilet area, and for two rooms. So in the waiting area, the clinic provide set up a 3 sofa to patient while waiting for their turn. So in this area also have the receptionist part. At the receptionist part, the patients come to register their name and to pay the bill. Also at this the receptionist customer come to register my sejahtera and scan the temperature for body temperature, because in this situation we are in the COVID situation, so we need to take care of the SOP. So in the at the receptionist part, there the clinic have a television at the wall behind it. So the patient the television provide is because the clinic want to entertain the patient to release their nervous while waiting their turns. So at the behind the waiting area, they have a toilet area. The clinic provide two toilets for female and male. At the same area also have the sink, and the beside of that sink have a door to enter the second room. Okay, the layout for the bathroom is almost same as we can see in the sketch. Almost same. They have a dental chair, and they also have a tool. The arrangement of the desk and desk and the uh, desk and the uh, closet is almost same. So in this at the for the at the second room at the behind have a two sink which is represent for each room. So assistant can easy to come and use it. That's it from me. Thank you.
Okay, my name is Wan Hazwani binti Wan Harun. I will discuss about limitation part. The first one is the limitation number 1, waiting room is so smellless, and number 2, workstation layout is difficult to achieve during the work times, and number 3 is a staff need to walk far between the desk to the treatment room, and number 4 did not have a pantry room for staff to rest, and the last one is number 5. Limitation number 5 is medicine part is not does not exist. So there are 5 limitation we recognize at the Taiping dentist. So we want to improve the new layout for the improvement. This slide we show the differences between old and the new one. We recognize the limitation and we make a solution or new planning layout for the dental care. This is a detailed new planning layout with based on the limitation. We added some part for the improvement for the efficiency in working, like we added some medication section like waiting area. We go to the largest and then pantry room, and this is a simple one, and we think this is efficiency for the new planning layout at the Taiping dental care.
Assalamualaikum. My name is Nur Syamini Shasha binti Suhaimi and my matrix number is 273968. Today I want to explain about the issues on ergonomics in this dental practice. The first one is when the dentist working for a long time in unpleasant positions or being in the same posture. Awkward postures are also developed because of inappropriate sitting, incorrect positioning of a patient or improper work techniques. A good or neutral posture means that the joints are being used near the middle of their full range of motion. Common awkward postures in dental practice include elbow and wrist flexion and thumb hyperextension, which have been shown to stress neurovascular structures and ligaments. Next, the dental often performing the same or similar tasks repetitively. Repetitive motions, particularly in scaling, root planing, and polishing, are extremely prevalent in dental practice. The risk of developing and musculoskeletal disorders increases when same or similar part of the body are used continuously, with few breaks or chances for rest. Highly repetitive tasks can lead to fatigue, tissue damage, discomfort, and eventually injury. This can occur even if the level of force is low and the work postures are not awkward. Lastly, is exerting excessive force. When a task requires them to exert a level that is too high for a particular muscle, it can damage the muscle or related tendons or joints and other soft tissues. An example of a gripping task requiring high force application could be holding small instruments for a prolonged period of time. This task is commonly performed with a pinch grip where the fingers are on one side of the object and the thumb is on the other. That's all from me. Thank you.
My name is Rashida binti Nordin and my meeting number is 272447. I will present for the suggestions to improve the ergonomics aspect. First is ideal posture of a dentist and patients. The ideal posture of a dentist gives optimal working condition for physical comfort to access visibility and control in the mouth of patient. Ensure that patient chair has a thin and flexible backrest. Ergonomic dental chair design will give the dentist and dental assistant good access to the oral cavity from all working angles without any necks having to be craned. Furthermore, patients are not being positioned too high. The tooth surface should be about elbow height to ensure your arms and shoulders are not raised and therefore strained unnecessarily. Second is hand instrument table positions. The use of the ergonomic aspect in this case is to make sure that hand instrument table and worktop are all within easy reach for each other for dentists and assistants. By considering the place, the instrument bridge over the chest of the patient and the hand instrument table meet the patients so that both can be reached by dentists and assistants from all working positions. The last suggestion to improve the ergonomic aspect is good and bad posture for dentists. A good posture provides the dentist to more working energy, reduce stress level, increase comfort, lack of pain and muscular tension, and also lower risk for therapeutical errors. Besides that, for the bad posture induce premature fatigue, pain, stress, and a negative attitude to work, high risk for musculoskeletal disorder, and a poor quality of work. It is important to ensure that there is enough space for dental staff to move and work in treatment rooms. A cramped working space will force musculars to work hard in ways they are not designed to. For the conclusion, the intervention or prevention strategies require an awareness of how to fit the job to the worker, not the worker to the job. Applying the ergonomic to the practice of dentistry not only could provide safety benefit, but a practice might also improve performance objective to greater productivity. The ergonomic and healthy workplace help the dental surgeons increase their performance without putting at risk their own health. One of the main goals of ergonomics in dentistry is to minimize the amount of the physical and mental stress that sometimes occurs day to day in a dental practice. Thank you. That's all from our group presentation.